So now we're going to perform the entire exam for the hand, the wrist, and the elbow. So the way I start off is I inspect, I use my eyes. So I first look at the hand, I palpate all the joints, the MCPs, the CMC. This is a very common place where patients report osteoarthritis. I also palpate all the interphalangeal joints, the PIPs and the DIPs. I look at all the joints. I look to see if there's a ganglion cyst, which is commonly located right here on this part of the wrist. Sometimes it could be located in the palmar side of the wrist. I also look at the DIPs to see if there are any mucus cysts, which you can find here sometimes. I look at the palmar fascia to see if there are any signs of a Dupuytren's contracture, where you'll have nodules and you'll have a contracted finger. I look at the elbow to see if there are any signs of olecranon bursitis. I then have the patient passively just put their hand down like this to see if there are any signs of a claw hand, which would suggest an ulnar neuropathy. I put your hand like this, palm down, open your fingers, and then close them all up. If the pinky is left astray like this, if it's separated, if your weakness with adduction of the pinky, that also suggests an ulnar neuropathy. After I inspect the hand, I then do sensation. So I use my 2-point discrimination test, which is my paper clip. I'm going to first evaluate the pointer finger. That would suggest a median nerve neuropathy. I have the patient close your eyes. You feel 1 or 2 pokes?
2.
And then the pinky as well?
2.
Excellent, that's sensation. The pinky is ulnar nerve and the pointer is median nerve. I then check strength. I tell the patient with your thumb, push up against me nice and strong. That's the abductor pollicis brevis, and that would suggest a median nerve neuropathy, also called carpal tunnel. I then use the ferment test, so I tell the patient to make a fist, hold this and keep your thumb nice and flat. This is ulnar nerve. If their thumb is flat, that's normal. If they end up flexing their thumb, that's abnormal. It's a positive test. It suggests a weakness of their ulnar nerve. And then I move on to the provocative maneuver. So in my head, I'm first thinking carpal tunnel. So for carpal tunnel, I'll have you make the Phelan test for 30 full seconds. Then I do the Tinel test, where again I'm going to percuss at the base of the palm, which is right here, for 30 full seconds. I'm trying to see if I can elicit any of the tingling down to the first 3 fingers. Then I do carpal compression, where I press at the base of the palm and I flex the hand up for 30 full seconds to see if I can elicit any of the tingling. And after that, I conclude with a Sperling test to rule out a cervical radiculopathy. So I just have the patient, I tilt their head back to the side and I push straight down and see if I can reproduce any of the tingling sensation. So that's ulnar nerve, that is median nerve. Next is the ulnar nerve. The ulnar nerve provocative maneuver is pretty, it's just one maneuver. I locate the cubital tunnel, I locate where the ulnar nerve sits. This is the olecranon, this is the medial epicondyle, it's right here in between, and I just percuss. I do the Tinel test right here at the level of the elbow and see if they have any tingling going down to their pinky. The next test is trigger finger. Have them open up your finger completely, your hands, and then close them and open them and see if there's any tenderness at the base of a finger, or see if a digit gets stuck along the way. That's trigger finger. The next test is de Quervain's. I have them hold their thumb and make a fist. And I'm going to just passively stretch these tendons right here, just like this, and see if there's any discomfort. Make a thumbs up and push towards yourself. Excellent. That's a thumbs up sign to see if there's any discomfort or irritation or tendinitis of the de Quervain's tendon. And then last, I conclude with epicondylitis evaluation. So for lateral epicondylitis, have the patient make a fist, tilt it up a little bit, push towards yourself nice and strong. Excellent. I'm going to passively just flex your wrist down and stretch that tendon. I'll do the Maudsley test, all the fingers out. With this finger, push up towards yourself nice and strong. See if there's any discomfort of the lateral tendons. And then for medial epicondylitis, make a fist and down a little bit and push towards you nice and strong. And that will cause medial pain. And I passively just extend the wrist up and stretch those tendons medially to see if there's any discomfort there. And that concludes the entire elbow, wrist, and hand exam.